up first. Go ahead, my friend.
Thank you, everyone. Welcome to the BAPS Swamiran Complex. We are very excited as we launch Ontario's first provincial vaccine clinic in the presence of Premier Doug Ford. In the joy of others lies our own. This motto of Pramukh Swami Maharaj, the founder of BAPS Charities, has driven the dedication and activities of the organization to serve communities around the world. We are proud to say that these motivating words continue to inspire community support even in the midst of a pandemic. Over the past 14 months, BAPS Charities has supported communities in Ontario and across Canada by donating PPE, distributing care packages, making phone calls of support, educating people through webinars, and organizing other initiatives. Most recently, in the month of March, BAPS Charities distributed more than 130,000 surgical-grade masks to families and communities across Ontario and Canada, and over 20,000 pounds of non-perishable food to food banks. During this pandemic, His Holiness Mahant Swami Maharaj, the inspirer of BAPS, has encouraged volunteers to help in local communities where possible, following the rules and guidelines of the government. BAPS has organized similar vaccine clinics in our centers in the USA, India, and England as needed. We thank the Government of Ontario for selecting BAPS Charities and to give us this opportunity to host a vaccine clinic here and serve the community. I would also like to thank the Ministry of Health for their support and applaud the volunteers of BAPS Charities who have stepped up, many taking time off from work to help set up and run this clinic to serve the community. We encourage everyone to take advantage of such clinics and remind everyone that even after you receive your first dose, it is very important to continue following Ontario's public health guidelines. It is now my pleasure to welcome Premier Doug Ford, Premier of Ontario, and request him to address the community. Thank you.
Well, first of all, good afternoon, everyone, and thank you, Yogesh, for that introduction. And thanks to the BAPS Charities for hosting us here today at the site of this new vaccine clinic. BAPS Charities has really stepped up throughout the pandemic, donating more than 130,000 masks to communities right across this country. And their volunteers have now taken on a challenge of setting up this pop-up vaccine clinic as part of our accelerated rollout to get needles into arms in high-risk neighborhoods. As we continue to make steady progress vaccinating our seniors and most vulnerable, they're helping get vaccines to the residential and industrial neighbors here in Etobicoke, many of whom are essential workers. It's incredible, and I want to thank you again for what you're doing right here. I want to also recognize Councillor Michael Ford, who is here with us today, and thank him for his incredible work on behalf of the great people of Etobicoke North. And my friends, we're relying on vaccination sites just like this one, vaccine clinics that will get thousands of shots done in the heart of communities where they will have the greatest impact in our fight against COVID-19. Because getting ahead of this virus, ending these lockdowns, reopening our schools, getting our small businesses back on their feet will all come down to one thing: vaccines. How fast we get vaccines into our province and into arms. How fast we can vaccinate critical mass of the population. The faster we get to that critical mass, the faster we can end lockdowns, open schools, and get life back to normal. And we all have a part to play. We need the federal government to continue leading the charge on getting us as many vaccines as possible. We need each of you to sign up and get your vaccine as soon as you're eligible. And for our part, we will continue building up capacity to get shots in arms. Over the past few months, we have ramped up our vaccine infrastructure. We now have the capacity to do millions of vaccines a month. And our capacity to get needles into arms grows every day, where they are needed most, with the new clinics like this one at the BAPS Temple. Last Friday, we expanded vaccine eligibility to all adults 50 and older in COVID hotspots. Yesterday, we began vaccinating education workers in hotspots neighborhoods in Peel and in Toronto. We have special teams across the province in hotspot communities, vaccinating those at greatest risk of infection, including essential workers who cannot work from home. Because it's critical that we stop COVID in these communities where it is spreading the fastest. That's why we're protecting those most at risk in 114 highly impacted neighborhoods across the province. This pop-up clinic will begin vaccinating local residents starting tomorrow. Community outreach will be led by the best people for the job, BAPS Charities, William Osler Health System, and local community organizations. These are the people with strong relationships with the surrounding community. These are the people who can build trust to combat vaccine hesitancy and protect our most vulnerable. At mobile vaccine clinics like BAPS and other high-risk neighborhoods, we are beginning to vaccinate adults 18 and over. We're opening employer-operated vaccine clinics right at the job sites. They're also vaccinating residents of surrounding communities. This is how we're protecting our workers and who can't work and go work at home, I should say. That's how we're going to protect these folks. We're fighting the virus with everything we've got, and vaccines remain our best defense. We have managed to vaccinate over 3.3 million Ontarians so far, and our pace of vaccine delivery is increasing rapidly. We're getting vaccines in arms as soon as we receive them. If we receive a steady supply of vaccine from the federal government, we expect to vaccinate 9 million Ontarians between April and the end of June. In the meantime, we must all do our part now and stay home to save lives. Before I hand it over to NPP and on, I want to wish our incredible Health Minister and Deputy Premier, Christine Elliott, a very happy birthday. Happy birthday, Christine. Actually, I called Christine and sang her a little song this morning, left it on her voicemail. I'll never make a career out of singing, I'll tell you that. But I'll tell you, Christine, as you've seen right from the beginning, has worked hard to help keep us safe throughout this whole pandemic and has stood side by side with me right from the get-go, so we're very, very grateful to have Christine with us. I want to thank you and God bless the people of Ontario. Now I'll hand it over to MPP Anand.
Thank you, Premier. Namaste and Jai Swaminarayan. Good afternoon, everybody. It is my pleasure to be here with my brother, big brother, I call it, Premier Ford, Minister Elliott, and Minister, happy birthday once again, Solicitor Jones, and my neighbor, Councillor Michael Ford. And with the members of BAPS Swaminarayan Mandir, Naresh Bhai, Yogesh Bhai, Deepan Bhai, Deepak Ruprelji, Vikram Khurana, and Parag Bhai. So thank you for all the blessings and inviting us today. What a wonderful week this has been. Started with the last week was Easter Monday. I had the opportunity to visit church, and today is the first day of holy month of Ramadan. We have Vaisakhi today, we have a Hindu New Year today, and a Navratri. So all the blessings are coming together, and our places of worship continue to be a pillar of strength in our community throughout the pandemic. And it's heartwarming to once again see them stepping forward to protect the communities across the province. As Premier said, Time and time again, the health and safety of all Ontarians has always been the province's top priority, and the vaccine will play an essential role in stopping COVID-19 and its tracks. Our government understands that not all individuals can easily travel for a vaccination appointment. That is why we are bringing vaccine closer to you, closer to home. Ontario's mobile vaccine clinics will ensure that our most vulnerable, as well as the resident living in hotspots like my community, neighborhoods highly impacted by the pandemic, are well protected and help to reduce the transmission of COVID-19. I would like to extend my heartfelt gratitude to all healthcare heroes, public health units, and the province for their tireless effort in making this possible. At this time, I want to say, मेरे ओंटारियो वासियों को ये मैं बताना चाहता हूँ, कोविड वैक्सीन का टीकाकरण आप और आपके अपनों की सुरक्षा के लिए आवश्यक है। आप सबसे विनम्र विनती है कि जब भी आपकी बारी आए, आप टीकाकरण का अपॉइंटमेंट जल्दी से बनाएं और जल्दी से जल्दी टीका लगवाएं। आ समय छे तुम्हारी बाई ऊंची करने ने कोविड-19 री रसी ले लियो। I want to say thank you, and as Swamiji said, in joy of other lies ours. It is time for us to roll up our sleeves. Thank you so much.
We'll go to the phone line for questions. First question, please.
From Randy Rath at Stage TV. Please go ahead.
Hi, Randy.
Hi, Premier. Hi. I'm wondering about the suspension of the use of Johnson & Johnson, the Johnson & Johnson vaccine in the United States. Is it going to have an impact on our vaccine rollout? And are you worried that it's going to create more vaccine hesitancy on top of what is already looking like a lot of hesitancy?
Yeah, I heard about that, and I guess we're going to have to wait to get the advice off Health Canada. And what I'll do is I'll pass this over to the Minister of Health. But yeah, I'm concerned when I hear that coming down from the U.S. But I'll pass it over to Minister Elliott.
Well, thank you, Randy. This is an issue that we are, of course, concerned about, but as you're probably aware, we don't have any of the J&J vaccines in Canada yet, but we will be following this with the National Advisory Committee on Immunizations as well as Health Canada to make sure that before any J&J is put into anyone's arms in Ontario, we need to know that it's going to be effective, but more importantly, that it's going to be safe. So we're following this very closely, and will be, Dr. Williams will be speaking with NACI and Public Health Canada with respect to this issue.
Follow-up?
Yeah, we seem to be having a degree of vaccine envy among the various public health units. Now, it's understandable that the vaccine will go to people 18 plus in Toronto hot zones and Peel hot zones, but when do you foresee people 18 plus in hot zones around the province, not just in those two jurisdictions, being able to receive it?
Yeah, Randy, it all depends on the supply. If we get more supply off the feds, and I know they're working hard, but we just need the supply. We have, I guess it's even gone up since yesterday, but it was 2.8 million people have appointments, and we're just waiting for more supply. We're ramping up pharmacies, up to 1,400 pharmacies. Keep in mind, we have 3,200 altogether, but as soon as we get that supply, we'll continue ramping it up. Toronto, again, opened up vaccine clinics, 3 of them, and then we have places like BAPS charities right here that opened up, and we're trying to do that to other areas right across the hotspots. So as soon as we get the ample supply, we'll be able to get that done, and I know everyone's anxious. Well, it's coming soon, folks.
Next question.
From Dave Woodard at Global News. Please go ahead.
Good afternoon, Premier.
Hi.
My first question is regarding child care centers. We know that they're staying open, but what's the plan that's going to make that happen? Will child care center workers be able to get vaccinated earlier, regardless of where they are? And what kind of stop are you looking at if they do have to close?
Well, I'm going to, before I pass it over to the Solicitor General, our goal is to get as many people vaccinated as possible. And I know everyone, wants to be first in line per se. But right now, we'll wait for the supply, and the supply comes in, we'll get to them. I know we're working on the special education teachers right across the province, which is absolutely critical. We're getting teachers in the hotspots vaccinated as we speak right now. And our goal is to vaccinate those folks that take care of childcare. But I just, without the supply, I just wish I could sit here and tell you the exact time, but I will pass it over to the Solicitor General.
Well, thank you. As you know, and the Premier just highlighted it, we are dealing with a supply issue. So as we increase, and last week we were able to announce that we were moving into the second phase of our vaccination plan, which of course does include vaccinating people and offering vaccines to individuals who cannot work from home. That is part of the second phase, and frankly, it is very much dependent on the supply that we receive. We have done an excellent job of vaccinating the most vulnerable. We see that in the long-term care homes and the retirement homes who are not getting the positivity rates and mercifully not having people get sick as much because we focused on the most vulnerable first. We'll continue to do that, and as Premier Ford said, as soon as we have sufficient supplies, we're going to make sure if you can't work from home, you have access to a vaccine. Thank you.
Follow-up?
Thank you. And Premier, looking at the hotspots and vaccinations, some are saying that the rollout is still rather confusing. Some people are able to book on the provincial booking site, others are not allowed to, while still others, like special education workers, can go to mass vaccination sites regardless of age, as long as they've got a letter saying that they should. Even one of those on your own vaccine task force said the rollout lacked clarity. So my question is, was there a better way to do this effectively?
Well, I'm going to, for the folks that find it confusing, I have to tell you that 2.8 million people didn't find it confusing. 3.3 million that we had vaccinated didn't find it confusing. So if I'm doing the math right, we're well over 6 million people that didn't find it confusing. Folks, it's very, very simple. And I'm going to wing this phone number, and please correct me if I'm wrong. It's 888-999-6944. That's 888-999-6944. Or you can go on the Ontario COVID vaccination site and book it. It's as simple as that. We also have organizations as we go into the high priority neighborhoods, the hot spots, organizations like BAPS. They reach out to their congregation and communities. And by the way, folks, when we go into these areas and we go into large companies, part of the agreement is you just don't do your employees, you just don't do your congregation, you reach out to the whole community in that hot zone, and bring them in. And they have done an incredible job here in such short notice. I believe, is it in an hour, you ended up booking like 4,500, roughly 4,500 appointments, and that's really, really incredible. And that's why, I know we've been saying this, and we haven't said it, the people out there haven't been saying it, but we are all in this together, and with community help, we're going to get through this. So people out there, please, sign up and come and get vaccinated as soon as possible. Once we get vaccinated, the lockdowns, we'll take those down, schools will go back, people will get back to normal, and it's proven in the long-term care and the seniors residents the effect that vaccines have, and they work. They work really, really well.
Next question.
From Colin DeMello at CTV News. Please go ahead.
Hi, good afternoon, Premier.
Hi,
the government is relying on businesses to volunteer the setup of vaccine clinics for their employees in high-risk neighborhoods. I'm wondering why your government wants to leave it up to those businesses to set up these vaccine clinics as opposed to just relying on the public health units or going to those businesses themselves in order to prevent some of these outbreaks?
Yeah, no, good question, Colin. But it's not just the businesses. It's a coordinated effort amongst the local hospital, be it William Osler here, and it has a lot to do with the public health units, ourselves, and organizations reaching out to us reaching out to them. I'm on the phone constantly, calling large employers right across the province in hot areas, hot spots, asking them if they're interested in supporting the program. And I have yet to have one person, refuse the call or say they aren't interested. I would like to pass it over to the Solicitor General. She's been doing a great job in charge of this.
So, Colin, the short answer is, why are we asking, encouraging organizations like BAPS, like businesses? Speed. We want to get vaccines in people's arms as quickly as possible. And these businesses are openly wanting to be willing partners because they understand that it means their employees, their employee families, the communities where they are situated are going to be better protected. I in no way believe that businesses and organizations are being in any way encouraged. They want to do this because they know at the end of the day it means more people get vaccinated and we can do it faster. Thank you.
Follow-up?
Thank you. We now know that people 18 to 49 can't actually sign up for a vaccine, despite you, Premier, telling them that they could go get a vaccine. There was certainly a lot of people who wanted to try to book an appointment but found out that they simply couldn't. I'm wondering, do you feel like that claim that you made last week was misleading? Because, we know a lot of people who are within that age range who felt misled by you.
Yeah, well, again, I never mislead anyone. I'm very clear right now. If you're in a hot area, a hot zone, and let's say an employer, or if you're at BAPS, it's 18 plus, and you're going to vaccinate that company, it doesn't matter if the person is 21 or 31 or 41 or 51. People want to get vaccinated. So no, not by any means would we do that. We want to make sure that we get the vaccines into people's arms as quickly as possible. Thank you.
Next question.
From Lorenda Redikoff at CBC News. Please go ahead.
Hi there, Premier. I see in the tech briefing about the vaccination process that AstraZeneca is not listed at all. So what does that mean for AstraZeneca going forward and for the pharmacy program?
I'll pass that to the Minister of Health.
Thank you. Well, we have just received a shipment of AstraZeneca, which will be distributed to pharmacies. We're still waiting to find out the delivery schedule for future deliveries of AstraZeneca. But we also have the opportunity, if we don't receive it in the near future, we have Moderna that can also be used. And we're also looking at whether Pfizer can be delivered to pharmacies. It has been in other jurisdictions, and so we have to abide by the cold storage requirements, of course. But as we receive supplies, we have to be very nimble and adept at making sure that we deliver them to the appropriate locations and keep them going in supplying vaccines, with the goal being to get as many needles into as many arms as possible.
Follow-up?
We've heard talk about the possibility of transferring patients from Ontario hospitals to other provinces where they're not as stretched in their ICUs. Has there been any talk with other provinces of possibly having that kind of relationship, for example, to Atlantic Canada?
Go ahead, Christine.
Okay. Well, what we're looking at now is building up capacity within Ontario. We know that many other provinces are experiencing difficulties with the variants. British Columbia, particularly with the Brazilian variant. Alberta and Saskatchewan as well. But with respect to workforces, if there are available teams that would be able to come from particularly the Atlantic provinces, we are certainly looking at that as an option, but we're also looking at building up capacity from our own teams by looking at Ontario Health, looking at the LHINs, making sure that we can bring in people that can help in our hospitals as well, so that the more experienced staff, those with intensive care experience, can then move up into our intensive care units to care for the number of patients that we have with COVID and who are there for other reasons as well.
We'll take the last question from the phone before we go to the floor.
From Max Cube at CTV Ottawa. Please go ahead.
Hi, Premier. Thanks for taking my question. I wanted to confirm, because we have been in touch with Ottawa Public Health here in the city, that one of the postal codes identified in Ottawa does not have any high-priority neighborhoods, and that's the K2V postal code. And again, we've confirmed with them multiple times that there are no priority neighborhoods there, yet it's still listed as a hotspot on the provincial website. I'm wondering why and what criteria is being used to identify these neighborhood as hotspots if our local public health unit is not identifying it as one.
Well, I'd be more than happy to talk to Dr. Etches about that, but I will pass it over to the Minister of Health, and they'll explain how the Health Ministry, the Ministry of Health, came up with the zip codes, or postal codes, I should say.
Well, thank you for the question. The hotspot areas were originally identified on the basis of historic data where there had been an acceleration in the number of cases, but it's also being reviewed on a regular basis by our Chief Medical Officer of Health, by Dr. Etches in the case of Ottawa, and by the Public Health Measures Table. And in the case of the Ottawa area that you're speaking of, we are trying to be proactive because we know that there are a number of congregate settings there in terms of retirement homes, long-term care homes, other areas of congregate living, seniors apartments and so on, where we know that we need to get in there before an outbreak happens. And so that was the primary reason why that particular location was decided upon, is because of the high numbers of congregate living within its borders.
Follow-up?
I understand that, Minister, but at the same time, the case rate when it comes to postal code in the province is in the 233rd. When it comes to hospitalization and death rates, 427. Those seniors would already be covered when it comes to the vaccine, when it comes to the rollout. So again, I would go back to the point of when it comes to those areas, the seniors are covered and those congregate settings are already covered because they were prioritized first. Why is it still been identified as a hotspot, and was there any political motivation to that?
First of all, with respect to the second part of your question, absolutely no political motivation whatsoever. This was all decided upon the basis of the clinical evidence and the recommendations of the Dr. Etches, the Chief Medical Officer of Health, and the Public Health Measures Table. In this particular case, not all of the seniors were covered. There's still many more that are living in congregate living. There's also people with intellectual and physical challenges who are also living in congregate settings. We need to protect them, and that was the basis of the decision being made to designate that area as a hotspot.
Okay, and we'll just move to the floor for the final question.
A little bit of a different pace, but everyone on the internet noticed, Mr. Premier, that you got your hair cut on the weekend. First of all, I'm a little envious, but I'm sure there's a story.
Well, there is. I look like a sheepdog, and so we literally got some dog clippers, and I got it on video to prove it. Or I know you guys are going to want to see it, but my daughter that lives at home's never cut anyone's hair in their life. I just sat in the chair and said, "Honey, go to town," and we couldn't even figure out how to work these clippers, and I grabbed them and zinged half my head so it's half bald on one side, and that's what happened. But on a more serious note, my heart breaks for these barbers and hairstylists, that have been shut down forever. It really does, and I'm going to do everything I can to get you back open. And I promise you, that'll be the last time. As much as my daughter did an incredible job for a rookie, I'm going back to the barbers, and I encourage everyone, just please, when we get back to opening up, these people have been hurting so much as a lot of people. So please just go out when we get open, go out and get your hair cut and get your hair styled and everything. So that's my message there. But yeah, it was my daughter that lives at our home that trimmed it up. I feel like, you know, it worked two ways. I got my hair cut and I lost 5 pounds when she chopped the hair off, and God knows I got about another 60 more pounds to go. So anyways, thank you everyone, and God bless.
Thanks, everyone.